Hello everyone, I am the TCM Chef Wan Jing, and today we are very happy to be here at Flower Moon Clinic. And today, sitting beside me, this is physician Li Jiabun, international board certified lactation consultant. Okay, and today she will be sharing with us about lactation massage and acupressure. Okay. So maybe before we start, can you share with us a little bit about yourself so that our friends here can know you better?
I graduated from Nanyang Technological University and Beijing University of Chinese Medicine, and then I'm international board certified LC, and then I'm a mother of a toddler and currently pregnant with number 2. And my special interests are in breastfeeding and childhood development. So I hope to nurture baby from the start, from TCM, biomedical, and as well as the Ayurvedic point of view.
So maybe you can share with us, actually what is lactation massage and what is acupressure about?
Okay, so basically it's a diagnosis and a treatment process, which the acupressure point is on the acupoints around the breast, near the breast area. So during our treatment, we'll diagnose what issue mummies are facing. Like if she have a blocked ducts, then we'll unclog the ducts, and then so that can prevent the further problem from occurring. And then like for those poor let down mummies, we'll stimulate on the acupoints that help to distress her and hence help with the milk flow.
What's poor let down?
So the milk flow will be very slow, or the milk is like dripping out, cannot spray smoothly.
What are the common problems you usually see in the clinic?
So there are 3 common problems we usually saw in the clinic. The first one is postnatal engorgement, which is your breast will feel very hard, warm and tender. This usually begins on the 3rd to 5th day after birth. So if properly treated, it can subside within 12 to 48 hours. So normally this one is caused by infrequent nursing, or you didn't manage to pump out frequently. So this is the reason lead to this engorgement. And then the second one is mastitis. So the pain and redness of the breast is usually more severe. And then mummies tends to have fever, body ache, nipple discharge, nausea, fatigue, headache, etc. Like those whole body symptoms. Yeah. And then if this one is left untreated, might need to go to the breast surgeon for needle aspiration. So the third one is low milk supply. So it means that there's not enough of the breast milk being produced to meet your baby growth. So main reason for this is mainly infrequent nursing, and as well as qi and blood deficiency. Yeah. So normally this will lead to the low milk supply. The first 2 are more common as they are more acute, but I still believe there's a lot of low supply mummies which they just compromise in finding substitute like milk powder to solve their problems.
So how is the treatment process like?
During the consultation, we will discuss what problems or difficulty mummies are facing, like it's because of latch, pumps, the pumping schedule, or the environment, like there's some negative advisor around keep telling you that you don't have enough of milk, something like that. So we'll advise accordingly. And then during the treatment, we're looking out for lumps, blockages, how's the let down reflex, etc. So and then we'll diagnose the mummy's body type, and then we'll provide suggestion accordingly, and most importantly we'll prescribe herbs to help with her condition.
So just now you mentioned about body type, right? So maybe you can tell us what are some of the common body types?
So the main body type we see is liver T stagnation. So mummy are still adapting. A lot of mummy are still adapting with a new role, because with the newborns, irregardless of being a first-time mom or you manage with the older kids and the newborn together. So the liver T stagnation often leads to blockage or poor let-down reflex. So mummies tend to have poor sleep quality because they need to wake up so often. So this poor sleep quality will actually worsen up the whole situation. So the our treatment which include acupressure and then the customized TCM herbs, this can help to reduce the stress, and then so that mummies can have a clearer minds to face the challenges, so that they can have a better solution or better decision on how to handle their newborns as well as their surrounding difficulties.
So are there any home remedies that they can actually try to help relieve the stress?
Home remedies, maybe you can take some rose tea.
Okay.
Yeah.
Because of the nice fragrance, right? Yeah. Then you'll feel more relaxed.
Yeah. So you can add 7 parts of rose into warm water, and then you can drink throughout the days. They can help you to distress and you feel more relaxed after that.
How is the usual course of treatment for lactation issues?
So actually it depends on the conditions. So for normal case, usually we require about 3 sessions. Like for those early stage of blocked ducts, like those if those blocked ducts, if left untreated, actually it often lead to severe mastitis, and you might need to go to breast surgeon for needle aspiration, etc. So, but for more complicated cases, like those yeast infection or chronic lumps, then it might take longer to recover. Like those for chronic lumps, if left untreated, you might only realize it when you have the next pregnancy, or every time before your menses come. You'll feel your breast become tender, your breast feel hard, or your breast feel very pain every time before you have your menses. Yeah. So for the yeast infection, so you might feel throbbing, like sharp pain each time before and after nurse. So this is a more complicated issue. Normally we will need some help from the Western side. So we'll work together to help with the mummies, yeah, so that they can recover faster and don't disturb on the breastfeeding journey. Yeah.
So for the chronic lump that you mentioned just now, say it will also occur in the next pregnancy?
Yeah. So normally during the next pregnancy, you might have mastitis during your pregnancy. So actually depends on which date you have the mastitis. Sometimes because some of the mummies might experience mastitis like end of the stage of pregnancy, this is still okay. Like the timing is not too far, and then you can treat after you delivered, because a lot of medicine which can't be used during the pregnancy. So but if you experience mastitis during the early pregnancy, this might be a bit hard and you might feel the pain throughout your pregnancy. So this one is quite painful and for the mummies now. So it's advisable to do a proper weaning. So yeah, so to prevent this from happening.
Can you share with us some acupressure and lactation massage techniques? Maybe we start with the acupressure first. What are some of the points that the mummies here can use to help relieve their problems?
Okay, so first point is 膻中穴. Okay, so it's on the ventral midline. Okay,
Along the midline.
Okay, and then it's on the acupoint between the nipple.
Just right between the two nipples.
Yes. Okay. So this one can help to reduce symptoms like mastitis, poor leg down, low milk supply, palpitation, or shortness of breath. So yeah, this one is very good for breastfeeding mummies. Yeah, on the midpoint of the nipple. So we do in a circular motion. Actually, you can just do for a few seconds, but you can do as many times as you need. Yeah, just like before you pumping or before you breastfeed, then you can just press. So the next one is 肩颈. Okay, so it's on the highest point on your shoulder. So it's the midpoint on the line between the most prominent vertebra and then to your shoulder here at acromion.
Okay, so it's the middle.
Yeah, it's on the middle. Yeah. Okay, so this one can help to promote lactation and then promote delivery, and then can help with the muscle relaxation. Okay, so first I will demonstrate the warm-up massage. So use your palm, okay, and do a circular motion on the top and under your breast. Circular motion. And then switch to the side, and then repeat the whole process until your breast feels softer. So this will take around 2 minutes. So this can help with the leg down. The second is C-shape massage. Okay, so you can do a C shape with your thumb over the nipple and then the index finger under. Okay, so support your breast, press the breast towards the chest wall, and then compress the breast and move the milk forwards towards the nipple. So release and repeat rhythmically. So press, compress, relax. Press, compress, relax. Press, compress, relax. Okay, so these two are good to do before breastfeed or before pumping.
Maybe you can share with us, right, some tips for our mummies who are going to breastfeed.
Okay, so first, prepare early. So there's a lot of things you can do even before delivery. So you can book for prenatal consultation so that you have a basic idea what to expect during your breastfeeding journey and what to do and what is the normal or abnormal things during the breastfeeding. Yeah, so you can also reduce a lot of intervention during those medical intervention during your delivery. Like because a lot of intervention normally leads to like edema or lack of the bonding with your newborns. Like if you have C-sec, you cannot do skin to skin immediately after your C-sec. Yeah, so you need a birth plan with your healthcare provider so that you can have a clear mind and both ways of understanding what to expect. Yeah, and then it's recommended to do skin to skin straight after delivery. So this one can help with the bonding and also helps with breastfeeding. And then second, you have to communicate with your family and then get their support on your decision. No matter you decide to breastfeed or don't want to breastfeed or anything. So family support is very important throughout your confinement. Yeah. And then third one, do not look for a shortcut way. Like you can try to, a lot of mommy try to introduce bottles or anything in the early days, like bottles, pacifiers or teats during the early days. Actually,
First week, you mean?
Yeah, first.
Okay.
Actually, it's first 2 months. It's not advised to introduce this during the first 2 months because this might cause nipple confusion, and then which might disturb your breastfeeding journey. You might have a harder time after that. And then the fourth one is look for healthcare provider which is support in breastfeeding. Like sometimes you might go to GP and they just prescribe you with some medicine which you don't know whether you can take or not. Yeah, so it's important to seek for those healthcare provider. They support breastfeeding, and then so that you feel safer. You feel safer to take the medicine.
And more confident of doing what they should be doing.
Yes, or can look for some breastfeeding groups like BMSG or those groups which can help in breastfeeding.